We're now going to discuss vesicoureteral reflux, and what that is, it's an abnormal backflow of urine. It can result in a predisposition to pyelonephritis and urinary tract infections. It results in reflux nephropathy, so you can have actual renal damage. It can cause scarring, poor renal growth, hypertension secondary to all this. It can be reflected with proteinuria, and renal insufficiency. It can lead to end-stage renal disease. So it's a very serious problem. It can be graded from 1 into 5. 1 is basically into a non-dilated ureter. 2 and 3 are higher up, all the way possibly into the kidneys. 4 and 5 are with dilated ureters, and they can become very tortuous. You probably don't need to know the staging for the exam. You just need to know that it exists. The diagnosis is going to be made on a voiding cystourethrogram. It lets you diagnose it, and at the same time you can grade it because of the way it looks on the X-ray. The grades 1 and 2 and even 3 many times will resolve on their own. They do need prophylactic antibiotics to help prevent urinary tract infections and subsequent scarring. Grades 4 and 5 usually do not resolve on their own and will need surgical reimplantation of the ureters. Here is a voiding cystourethrogram, and you can see that this patient has bilateral refluxing all the way up to the kidneys. Again, medical management first, and higher grade ones will require surgery. You need to be very aggressive in treating infections, and if they start breaking through with many infections, they probably need to go ahead to surgery.